What does this look like to you? This might only look like a regular bench to you, but for hundreds and thousands of Australians, this is their home. Many might think that they are only homeless due to drugs and alcohol addictions, but that is not the case for many Australians. Homelessness is mainly caused by the lack of affordable housing, unemployment, poverty, or domestic violence. In the past 5 years, the number of homeless people has increased by 17%. The number will increase due to Covid-19, where many people lost their jobs. This contributes to the downfall of Australia's economy and sense of community. But as Sun Tzu once said, in the midst of chaos, there are also opportunities. Our life-saving solution will help thousands of Australians to get back on their feet, while also helping the elderly and disabled. We will help to provide the homeless with shelters and food, while helping the elderly and disabled to find someone who can take care of them. There are 3.8 million people over the age of 65. This is 15% of Australia's population, many who are having trouble finding the right care and appropriate living space. Our proposal would help these two big problems in Australia: homelessness and home-based care of the elderly and disabled. With our solution, we would develop the homeless to live with the elderly and disabled, providing shelter and the homeless while providing care for the elderly and disabled. You might be concerned about allowing strangers into home of our most vulnerable, but even the most professional healthcare can be a threat at times. For example, look at Annie Marie Smith, who died from being malnourished after her professionally trained carer didn't look after her. Only this week, a Royal Commission has found that our Commonwealth Government still has no plan to protect the vulnerable in our aged care facilities from Covid-19 or any other pandemic. Appropriate government oversight and monitoring are essential for any caring services. Our proposal would allow not only existing homeless people to get clean from any drugs or alcohol addiction, but also allow who have lost their jobs or businesses and are most vulnerable to becoming homeless as a result of the current pandemic to become trained in the provision of home care services. They will receive a recognized training certificate learning how to take care of the elderly and disabled in their own home, enabling them to live with an elderly or disabled person. They would be matched with a person already living in their area who would benefit from their care. It's an example which would apply to most towns and cities. We have used the data from the city of Mount Gambier. The data shows areas with aged single-person dwellings are increasing with our aging population. Many of these areas are located where housing affordability is beyond the reach of regular Australian, and aging housing stock means maintenance that is beyond the capacity of the aged occupants. The cost of moving into aged care facilities is also prohibitive for aged persons who are asset but rich but income poor. Combined with homelessness, which is also prevalent in our communities, we have a solution to address these issues. What are you going to do to help the homeless, elderly, and disabled?